Hey everyone, thank you so much for joining us today to discuss the pandemic's impact on the financial health of Connecticut hospitals. We are joined today by Jennifer Jackson of CHA, Eric Swanson of Kaufman Hall, Susan Martin, the CFO and VP of Finance at Middlesex Health, as well as Dr. Saeed Hussein of Trinity Health of New England. Jennifer Jackson of CHA will start.
Thank you, Nicole, and thank you all for being here. We wanted to share with you that today CHA is releasing a report on the impact of the COVID-19 pandemic on the financial health of hospitals. The report is supported by an independent analysis conducted by Kaufman Hall, and as Nicole noted, we're lucky to have Eric Swanson with us today, and he'll share information with you just in a moment. For those of you that are not familiar with Kaufman Hall, they are a nationally recognized healthcare economics firm, and glad that they could help us. So in thinking about, as you review the report, and I think you all got a copy of it, the findings show a staggering and lasting impact. 2022 was the worst year financially for Connecticut hospitals since the pandemic began. Our expenses, driven by high inflation and other pressures, are far outpacing revenue. Hospitals are treating more acutely ill patients, and we have Dr. Hussein who will share some perspective on that, and workforce shortages are impacting our financial health. These financial challenges that we want to talk to you about today threaten the care that Connecticut hospitals give to patients, the services that they provide in their communities, and the over 200,000 jobs that they support. The report sounds the alarm that Connecticut must focus on sustaining a robust healthcare delivery systems for patients across the state. And as the backbone of the healthcare system, hospitals simply cannot do this if they cannot cover their costs. So we all need to work together to support hospitals, address workforce challenges, and we need to make sure that we do not hinder hospitals' ability to provide quality and accessible care. And that's what we're looking forward to talking to you about today. So we're going to have Eric start us off. Eric, I'll turn it over to you. Eric is Senior Vice President leading Kaufman Hall's Data and Analytics Group, and he'll provide an overview of their key findings.
Jennifer, thank you for that introduction, and good afternoon, everyone. So as Jennifer noted, as we conducted this report, there were some key high-level findings that I'd like to share with you all today. The first, as Jennifer noted, was for the state of Connecticut, 2022 ended up being the worst year since the beginning of the pandemic for hospitals across the state. Even inclusive of provider relief and other stimulus funds, what we noted is that the operating margin in 2022
was the worst year.
Fell to a negative 1% as compared with pre-pandemic level margins of 4.6%, highlighting the dramatic decline in operating performance. This reflects a median decline of nearly 67%, which unfortunately lags the nation as a whole, which recognized a reduction of nearly 20% in declines in margin, meaning that unfortunately Connecticut underperformed the nation as a whole, despite the entire industry facing these unprecedented challenges. This resulted in a loss in income in 2022 for the hospitals across the state of Connecticut of $164 million, which adds to the total loss relative to pre-pandemic levels of $770 million in 2022. That's $770 million less in income than expected in pre-pandemic levels. And since the beginning of the pandemic, totaling nearly $1.6 billion lost in income, inclusive of stimulus funds. It's important to note that these prolonged negative operating margins are ultimately unsustainable and impact the organizations in myriad ways, some of which you'll hear about today. Well, what is driving these changes? Well, it may come as no surprise to you that what's driving these changes is an extraordinary increase in expense, totaling nearly $3.5 billion over pre-pandemic levels, for a 23% increase in expense. And unfortunately, this also outpaces the growth in expense nationwide, which is at 20%. Now, within this expense, the primary driver of this is labor expense. with labor expense increases both on the employed and contract labor side of the house. And again, this is driven by increases of $1.9 billion over pre-pandemic levels. It's also worth noting that as contract labor utilization increased over the course of 2022, so did the rates, which were commanded by those organizations, leading to a 61% increase in contract labor costs for Connecticut hospitals. Unfortunately, non-labor expenses were not also spared from these pressures. And we note that due to supply chain disruptions and inflationary pressures, those non-labor expenses also increased to the tune of nearly $1.6 billion over pre-pandemic. Finally, it's also worth noting here that in light of these tremendous expense increases, volumes remain somewhat anemic, with fewer but sicker patients coming into the hospital. And unfortunately, due to some of the labor shortages in post-acute sites of care, those fewer patients coming in are forced to stay longer as hospitals are combating the challenges with discharging those patients to those post-acute sites of care that may lack the personnel and capacity to take them. And ultimately, what this drives is a continued increase in expense without offsetting revenue to cover those costs. You know, ultimately, as a whole, as we think about what this report demonstrates and the unprecedented challenges in Connecticut, it underscores the financial and operational challenges that threaten Connecticut hospitals and that they continue to face over the first 3 years of this pandemic. And unfortunately, we don't see many signs of abatement for many of these challenges in the upcoming years as well. So these are the key levels of key findings of the report, and happy to turn it over to Susan. Thank you.
Thanks, Eric. Yeah, hi, I'm Sue Martin from Middlesex Health, and I just want to talk a little bit more on the expense side of things. Certainly, as you just heard, our expenses are increasing and are far outpacing our revenue increases. And that's really putting a strain on us and all Connecticut hospitals. Here at Middlesex, we have experienced those similar cost increases as Eric just described, and these cost increases are continuing. In just the first 4 months of this fiscal year, our costs for medical supplies alone have increased another 10% over the same time period last year. As just one example, just recently, one of our medical supply vendors tripled their prices overnight. So we were spending over $1 million with this company on medical supplies needed for our patients, and those prices tripled overnight. All of the medical supply vendors and the pharmaceutical manufacturers, they can and they do pass along all their costs, plus their profit margin on to us. However, we have very limited ability to recoup these costs through our reimbursements. Compounding all of this is a significant underpayment by the government payers. Hospitals in Connecticut are facing a $1.1 billion Medicare loss and $993 million in Medicaid losses. Medicaid payments average only about 68 cents on every dollar of costs that we incur to take care of those patients. And this results in more than just financial losses. This situation also hinders our efforts to meet the healthcare needs of the Medicaid beneficiaries. And it shifts costs to the employers and the individuals with commercial insurance, resulting in rising premium and other out-of-pocket costs for those patients. As the number of Medicaid beneficiaries continues to grow, and as our population continues to age into Medicare, this situation will just continue to worsen. As an independent hospital serving the greater Middlesex County, we're really fortunate. We have a very dedicated team of caregivers and staff who work tirelessly to ensure that we continue to provide high quality, safe care for everybody in our community. We've been weathering this storm by being creative and trying to be as efficient as we possibly can, but our reimbursement must be adjusted to meet these cost increases before it becomes a real crisis. And now we're going to turn it over to Dr. Hussain to talk about some of the labor issues.
Thank you, Susan. Good afternoon, everybody. My name is Saeed Hussain. I'm Chief Clinical Officer at Trinity Health of New England. So I'll touch on a couple things really important for us. First is the acuity of patients that we're seeing in all of our hospitals across Connecticut. And by this, I mean, we're seeing patients who are sicker than pre-pandemic levels and those that stay longer in our facilities. And it's important to understand this is a multifactorial issue. So we have an aging population with more chronicity of disease across this country, across Connecticut. We also have seen, because of the pandemic, people were hesitant at first to seek care, which meant diagnoses being made at a later stage in a disease cycle than earlier, which means sicker patients. And then one other thing that is important for all of us to recognize as healthcare leaders is the disparities that we've uncovered that have always been there, but uncovered even more so during the course of this pandemic, with minority populations with access to healthcare and higher levels of disease as a result of not getting proper timely care when necessary. So all of these things have led to some of the dynamics that we're seeing play out today in all of our hospitals, coupled with probably an unprecedented workforce challenge, which runs the entire spectrum. So it's not only physicians, it's not nurses, it's everyone, including other allied healthcare staff. And we've seen during the course of this pandemic, there's been a higher rate of burnout, of retirements, initial stages of this pandemic, but then that has now morphed into, very attractive offers for some of our RNs, for instance, for nurses to be travelers, where the salaries are pretty high. And those labor costs have actually sapped into some of these margins, some of the things that you've heard earlier during this report. And at Trinity Health of New England, we've had to think outside the box in terms of what innovative strategies we can deploy. And it's not unique to us. Other healthcare systems across Connecticut are doing the same, including how do we leverage a more flexible workforce? How can we implement different models of care, for instance, to supplement our existing staff to prevent burnout, to ensure that we always provide high quality care to our patients, our doors are always open. And then also creating pipelines for future employment for our future colleagues across Connecticut. So those are some of the things we're doing, but it's really, really important that we understand the consequences of what we're going through financially as a healthcare industry in Connecticut, but also around the nation. There is no mission without a margin. It's really important that financially we are all stable to be able to keep our doors open, keep those innovative programs in place and build upon them to ultimately serve our communities. That's why we're all here, to serve our patients, to serve our communities in Connecticut, and being fiscally stable, strong, and sound is critically important. And I'll turn it over to Jennifer.
Thank you all. Eric, thank you for sharing the findings, for conducting the study, and for sharing the findings. And Susan and Saeed, I think it was really helpful for us to, for you to provide the context for those findings in terms of what hospitals face every day. So I think we've heard a really consistent message here today. Hospitals are facing significant financial pressure and they need support. We need support for our workforce. We need Medicaid underpayment addressed, and we need to avoid policies or legislation that made it worse. This deserves the attention of policymakers and the public to ensure that we're able to continue to care for our patients and provide services to our community. As Saeed just said, there are consequences to these issues. So Connecticut cannot be strong as a state unless our hospitals are strong. And we appreciate your attention today. And Nicole, I'll turn it back to you for questions.
Thanks, Jennifer. So if you have a question, please just raise your hand and we'll get to everyone. Christine Stuart from CT News Junkie.
Thanks, Nicole, and thanks, Jennifer. So my question is, Saeed said that there is no mission without a margin. What does that margin look like for you guys?
Certainly, I'll ask if others want to comment, but right now on a statewide basis, and Eric, maybe you want to jump in, on a statewide basis, it's negative, a margin. And even for hospitals who have a margin, I think it's invoking what Saeed said, as you pointed out, they are all facing very significant financial pressures that have the consequences we talked about. Eric, you might want to comment.
Yeah, I'll just add here. I think a few points worth noting is, one is, even in what would be considered a good year, operating margins for hospitals are in the low single-digit %, and recognizing that every little bit of that margin is required for maintaining capital investments and retaining investment in those innovative programs, as Dr. Hussain noted. It's also worth mentioning here that even in the months with these challenges ahead, if there are months where it was even a break even, so non-negative, that is still not sufficient to allow for these ongoing capital investments. So certainly it would be moving back to those pre-pandemic levels margin, if not potentially even higher, to fully meet all those needs.
And just a follow-up question. I know that, doctors do no harm. And has the Lamont administration, with the proposals it put forward, do more harm for hospitals? Would it just be better for them to not go forward with the proposals that they've pitched to change the industry here?
We think so. I mean, we strongly oppose proposals that reduce vital funding to hospitals and restrict our ability to provide care. We don't think the intention of the governor or any others who are making proposals is to strain hospitals and the healthcare system, but that's what these policies would do. So we want to be at the table. We were very pleased to hear the governor say that he wanted everyone at the table. We've been at the table since 2020, both in our pandemic response and also in discussions about the cost growth benchmark. So we're really encouraged that he wants everyone to work together to be part of the solution, and that's what we think needs to happen.
Thanks, Christine. Next, we're going to go to Paul Hughes from the Republican American.
Thanks. Just trying to clarify, you guys talk about the 2022 fiscal year, but the 2021 fiscal year ended in September. So I'm a little confused here. What fiscal year are you actually talking about?
Yeah, this is Eric. So what we are talking about here is the calendar year 2022, and ultimately as we adjust for the fiscal year 2022 ending in the middle of 2022, ultimately for many hospitals, although some may be on slightly different fiscal years. So there's not a universal standard. It's those who completed their fiscal year 2022 throughout the course of last year.
All right, but that's a technical.
Yep.
Where do things stand now? Here we are. What's the situation today as we're talking?
I can mention, I mean, at Middlesex, we are basically, so our fiscal year is September 30th. So we started our new fiscal year October 1st. And our hospital is at about a break even. But in addition to our hospital, almost all of us support primary care physician groups and primary care doctors, so they can be out there in our communities. And they always have a loss that we support. We've received a little bit of funding this year. It's in our numbers. That's helped us. It was the last of some reimbursements that we received because of COVID expenses for previous years. So that's helped us a little bit. We actually have been very busy for the first few months of this year. But as you heard, the acuity is really high. The costs are really high. The reimbursement hasn't changed. So it's really not helping us, even though that we can be busy and have more patients. It's not helping us from a financial perspective. And as you also, I'm sorry.
No, please go ahead.
That's okay.
You were talking about the tail end of the federal funds for COVID, correct?
Yes. Yeah. There's no more of that in our pipeline. I know that for sure.
So I just wanted to chime in real quick to piggyback on what Susan just mentioned, Paul, that these are challenging times for healthcare. We're forced as healthcare leaders to think outside the box, but it's important to also understand that revenue remains stagnant, and all of our other costs, including labor and non-labor, have gone up. They have gone up through the roof. And so unless there's some critical thinking and policy changes from leaders, you know, we need that assistance, healthcare in general across Connecticut, to be able to sustain our programs and build programs, initiatives for our communities.
Okay, and yeah, maybe this is for Jennifer. How much do you need?
We certainly are, with the help of Eric and others, we haven't set a specific dollar amount because a lot of this is investments in our workforce where we need the financial support. So that's what we're looking forward to, working with policymakers to quantify that.
Okay, thank you very much.
Thanks, Paul. Next, we're going to go to Liese at the New Haven Business Journal, and then we'll go to Keith at the Connecticut Mirror.
Hi, thank you. This is a question specifically for Eric. what specific factors are responsible for Connecticut performing so poorly compared to the rest of the country?
Well, here's what I would mention is that the nation as a whole has been challenged quite significantly. And I wouldn't say that there is a specific factor to Connecticut that is unfortunately driving that. As noted, increased acuity certainly drives some of this. The overall labor shortages that prevent, in many cases, organizations, hospitals from discharging the patients is in a timely fashion as they would prefer, leading to increased expense and stagnant revenues and the overall inflationary pressures. So I would say that I don't think that Connecticut is unusually poor performer relative to the country as a whole, particularly as you look at the variation. They just happen to underperform given the multifactorial nature of all of these challenges.
Yeah, and just one more specific question for Mr. Hussein and Ms. Martin. Do you have any plans in the immediate future to make cuts to your workforce or your programs in response to these financial issues?
So Lisa, what I'll say is we're always focused, as all the healthcare systems are across Connecticut, to be able to provide safe and high quality and safe care at all times with, the optimal staffing that is necessary. We're committed to that, to provide safe patient care.
Yeah, and I would really kind of echo that. Obviously, that is our mission, is to provide care for everybody in our community, regardless of their ability to pay. And many of the programs that we have here are programs nobody else does provide because there isn't reimbursement or adequate reimbursement for those programs. So we really are the safety net for our communities. And as you just heard, we all do the same thing in hospitals. We look every day if there's a position open, do we really need to fill that position? But in certain areas, we can't even get the staff that we really need in a lot of the clinical areas. And that's why we're being forced to pay much higher rates than we had seen previously.
So that means no cuts.
We would only cut as appropriate. If there was an excess for some reason we weren't providing a service or there wasn't need for that service any longer in the community, then we certainly wouldn't have those programs.
Well, and I think Susan and Saeed, correct me if you think differently or have more to add, but I think it really goes back to the consequences that we're talking about, that now you don't have plans, but as you talked about, Susan, we could be forced to curtail services. And so there are consequences to further harming hospitals financially.
Yep, that's very true.
Yep, not to cause any panic, but this is a very, very tough time for healthcare across the country, and folks need to understand that. We in healthcare are committed to be able to provide services at all times to everybody, irrespective of whether, to Susan's point, whether or not they can pay. I can cite healthcare systems across Connecticut that came together under the CH umbrella, did so many initiatives for the underserved, through the course of this pandemic. But it is really, really important that we shine a light on this.
I think we are frozen here. So let's see. Oh, we're back. Dr. Hussein, you cut out just for a moment.
Sorry, that's it.
Okay, thank you. Lisa, are you all set?
Yes, thanks.
Okay, great. So we will move to Keith at the mirror, and then we will go to Sue at AP.
Thanks, Nicole. I have two questions, if that's okay. First one for Dr. Hussein. You mentioned the problem, of course, with patients being sicker, and I understand a lot of folks may have deferred healthcare at different times during the pandemic. Are you seeing any indications also that there are some indications patients are coming in sicker because, quite frankly, they've had COVID, particularly patients with lung or heart issues? Do we have any sense if the infections and the toll they're taking on the Connecticut patient population could lead to sicker than average patients for many years to come?
So that's a good question, and I don't want to comment on something without having data to back this up. So, but we've managed COVID fairly well in Connecticut. across different healthcare systems. We've been able to provide vaccine clinics and other modalities of treatment. But to your earlier point, yes, we are seeing, and I outlined the number of it's multifactorial why we're seeing sicker patients, aging population, more chronic diseases, deferral of annual wellness visits, screening mammograms, colonoscopies, especially that we saw early on in the pandemic, all play a key role in why we're seeing more advanced disease at our hospitals. And coupled with the fact we've also noticed that visits have declined, right, to the EDs and other gateways, traditional gateways to hospitals. And that's part of the reason also is because of expansion of healthcare, right? Access has been expanded with telehealth and other modalities. So that has helped, but it doesn't necessarily help in terms of those annual wellness visits where you need to go see a doctor, get those screening modalities, see physicians, et cetera. So all of that coming together is where we're at now.
Okay. The second question's for Jennifer. You made it clear, Jennifer, that in terms of what the state can do, it's sort of a holistic approach you're looking for, whether it's workforce development or addressing Medicaid rates or helping the hospitals deal with expiring ARPA dollars. We didn't really talk about the provider tax. I am just curious only because it had such an unstable beginning, and just when the industry settled its lawsuit with the state, that was in 2019, before the pandemic. Is this something also as part of a larger approach to the long-term fiscal stability of hospitals you'd like to see the General Assembly revisit, if only even from a study angle?
Keith, that's an interesting question. And, reflecting on the settlement reminds us that Connecticut hospitals remain one of the largest taxpayers in the state of Connecticut. Hospitals pay $850 million in tax. They receive about 12 million less than that back in payments. And the benefit to the state is close to 600 million. And as Sue talked about, the annual shortfall from Medicaid is almost $1 billion. And combined with Medicare, we're looking at over $2.1 billion in shortfall. So to your point about the next step, we think that we definitely need to address Medicaid underfunding. And it's why everyone needs to be at the table. And we think rather than policies that would take money out of an industry that's already experiencing significant financial hardships, that we really need to look at a Medicaid system that addresses the underlying causes of poor health and inequities, as Saeed talked about. And so we're ready to sit down and talk about what the next phase looks like.
Okay. Oh, and Jennifer, if there's time, could you also just clarify for me? I'm just repeating an earlier question. Are there any specific proposals that the Obama administration offered this year as part of its new biennial budget that you think would be working counter to this report that would put a particular stress on the industry?
Yes, there are several proposals, and to your point about time, we'd be happy to talk about it more specifically. And we actually have testified on a number of bills that are similar to the governor's proposal, eliminating facility fees, capping out-of-network costs, which is just designed to give the insurance industry our upper hand in negotiations, which I'm sure Sue can talk about, is certainly not necessary. Certainly, we are adamantly opposed to staffing ratios because of the situation that Saeed talked about. So yes, there are specific proposals, but most importantly, we think we just have to focus on what will improve the situation. And then, as you raised earlier, long-term, how do we get, or longer term, how do we start to sit down and get at how to address Medicaid underfunding?
Thank you.
Thanks, Keith. Next, we're going to go to Sue Haigh, and then we will go to Dave Major at WTIC. Sue, go ahead.
Thanks, Nicole. Are any of the hospitals in Connecticut at risk of closure? And is there also a risk possibly of elimination of some major services, like, say, maternity wards, because of this constraint that you're talking about?
Well, All of the hospitals are experiencing significant financial pressures and the other issues that we talked about, sicker patients and workforce. But as your question implies, some are affected more than others. We're talking about this as an industry as a whole. But yes, some are affected more than others. And they are making sometimes difficult decisions, to your point about closing services. And we need the flexibility to respond to the pressures that we're under and to be able to step back and take a look at how we remain financially viable for our communities. And that's really what this is about.
But
Yeah, I
are
think
any
I'm
at the,
just gonna add, sorry, I'm just gonna add to Jennifer put it really, really nicely. And we just have to be responsible stewards, right? During these challenging times.
but are any actually at the point where they're on the verge of closing? Or do you think that, or also do you see an uptick in elimination of some of these services like we've been seeing already, like closure of maternity wards?
We may see an uptick, yes. I think certainly some of the proposals such as staffing ratios, we know will result in significant delay in care and potential closures. I think the answer to your question as of today or tomorrow, are there hospitals in danger of closing? No, but there are hospitals that their long-term prospect, and Sue talked about it, that the pressures, as Eric talked about, the pressures are continuing. They feel unrelenting. In some cases, they're accelerating. So we do need to be concerned about what's down the road.
And I just
I'll
want,
just add, I think, I'm sorry, with any business, there's only so long you can go with not having a profit or having a negative margin. Certainly here at Middlesex, we're here to provide services for our community, and we provide the services that are needed here. We go out and survey our community. Our goal is not to eliminate services. In fact, we're being asked to add more and more services because they're not available anywhere else. So certainly our goal is to remain a viable organization so that we can continue to provide services for our community well into the future.
thank you for that. And I just wanted to clarify with Eric regarding where Connecticut hospitals stand in contrast to other states. What are you actually referring to? Are we like our hospitals are earning less or than other states, or is it are the losses are the largest in the country? I just wanted you to clarify that, please.
Yeah, so neither of those. So what we find
Okay.
is from a national basis, Connecticut is underperforming the nation as a whole, but is certainly not the worst performing state. So the nation as a whole saw some declines of nearly 20% in margin over the course of FY22. Connecticut at minus 67%, but there are other states that have been more significantly impacted and others less. So unfortunately, underperforming the nation as a whole, but not the worst.
And where does Connecticut normally stand?
I don't have that figure off the top of my head.
Okay.
But Eric, we do have some unique factors. I think you talked about some, and Susan and Saeed did, certainly in terms of contract labor. We have specific factors in our state that drove that. We also are 48th in the nation in terms of Medicaid payment levels. And so we do have, and COVID came to us early, came to us in multiple waves. So we needed to mount an incredibly strong and prolonged response to COVID that frankly continues to this day.
And the other thing, if I could add, Jennifer, is that we don't have a large, thriving, growing population, right? We have an aging population across the state, in addition to some of the things you've described, which adds to the challenges, as well as it's a little bit more difficult to recruit. That's why it's important that healthcare systems are able to invest in their healthcare workers, colleagues, to be able to recruit and retain.
Yeah, and I can just add on to that to kind of hopefully put the pieces together. As our population ages, again, it's the government payers who pay us the least for the services that we're providing. So as we have a smaller base of those commercially insured patients, there is less revenue to be spread to cover those losses that we have from Medicaid and Medicare.
That's helpful. Thank you very much.
Thanks, Sue. And I believe that is all the questions that we have. Anyone else? Going once, going twice. All right, we are all set then. Thank you so much, everyone, for joining us today.
Thank you.
Thank you so much.
Thank
Thanks.
you.
Thanks.